Hello, this is Progressive Cynic, and in this video I will be talking about healthcare accessibility in the United States. You often hear Republicans talk about how the United States has the best healthcare system in the world, and any attempts to increase accessibility are just going to make it worse, and even worse than that, socialist. Well, in last week's news cycle, we saw a very revealing quote from Representative Inhofe in regard to his recent heart problems. Now, Representative Inhofe, during a routine colonoscopy, was found to have a severe heart problem. He had massive blockages of plaque in all of his cardiac vessels, and he had to have a quadruple bypass. This is an incredibly serious operation, and he really could have died had they not caught it in time. Now, in an interview surrounding, in the aftermath of this surgery, Representative Inhofe said something incredibly revealing. He said, "A person can find out here in the U.S. that he has an emergency situation where he has got to have immediate heart surgery. And if you are in a country other than the U.S., a lot of them, you can't get it done. In my case, with my age, that would have been about a 6-month wait because I hadn't had a heart attack." Now, this quote is remarkable in that it gives us an insight into just how incredibly egocentric some of these politicians are. It is true that in some countries that have socialized medicine, there is a wait for procedures. It's called triage. More needy people will get moved to the top of a list, and, well, just because you can pay for an operation does not necessarily mean you're going to get it. This is why many really wealthy people from across the world will go to the United States in order to get immediate operations. That said, it does not actually mean that it's a good healthcare system in the general welfare sense. Look, Inhofe is a representative of the United States government. He has very good health insurance, and he's very wealthy. He's in fact a millionaire. This means that he can buy the very best health care, even if his insurance doesn't cover it, which, well, it's a gold-plated Cadillac plan paid for by the American people, so odds are it can. So he's looking at the healthcare system in a snapshot for someone who's very wealthy. If you don't have insurance, or you have cut-rate insurance because you live at McDonald's, do you really think you're able to get that incredibly quick and incredibly high-quality care? You think someone living in, like, rural Mississippi is going to be able to get the same amount of care that you got, Mr. Inhofe? It's simply not true. Never mind the fact that people who have such insurance rarely even get good ability to go to doctors for routine checks. This ailment of Mr. Inhofe's was discovered during a routine check at the doctor's, the kind of check that most Americans cannot get because their insurance does not cover it. It's ultimately representative of the fact that this guy does not know anything about the current healthcare situation. Yes, if you're wealthy, you can get whatever you want in the United States, but if you're poor, you're pretty much out of luck. You don't have a socialized healthcare system in order to ensure you have accessibility within the healthcare markets. You're at the mercy of a private healthcare system, and if you're not wealthy, you get screwed. I would argue that while Mr. Inhofe says, oh, a 6-month wait would have been horrible, not getting care at all is worse. And this is a problem that tens of thousands of Americans every year face. The United States is one of those countries where we have tens of thousands of deaths due to untreated medical problems because of our current lack of a socialized healthcare system. In effect, the statistics demonstrate just how egocentric this guy is. And unfortunately, he's not alone. Our politicians get the very best care. So sometimes, some of them forget to, they don't realize that they are not representative of the entire American population. they are actually representing a very, very small minority of people who have infinite access to care, where the rest of the American population does not. Thank you. This has been The Progressive Cynic. Please follow my blog, theprogressivecynic.com, and follow my YouTube channel.